Hey guys, whether you're trying to use cannabis to help chronic pain or immediate pain, this video is going to go into what types of products to look for to deal with that condition. Blake, how can cannabis treat pain?
At Zion, when we get asked a question, we think about what kind of medicines do we have in our pool? When I say medicines, I mean what cannabinoids are available. Because again, we are trying to look at actually helping to alleviate the condition rather than just patching it over or not worrying about the condition because I'm in a high state or something like that.
Right. I mean, that's the important part about this whole series is we're trying to get to the crux of like why cannabis actually helps, destigmatize the plant in general, and use it as a tool in the medical provider's toolbox to help real conditions. So it's really important.
So when we think about pain, I immediately actually think about my father. So my father had cancer and he was immediately prescribed opioids. The problem with that way of thinking is either they're going to make him feel sick and it's not going to work for him, or they work well, or he gets addicted. I mean, we only have a couple outcomes here. And hopefully the body itself heals. But if the body doesn't heal the way that it needs to, there will be this perpetual pain that occurs.
Yes.
And so
and
what do you
as
do?
Providers, we know this will happen. And we use those things anyway, knowing that later we might have to deal with an opioid addiction. We might have to deal with the side effects of the opioids, but we don't typically have a better tool up until now.
That's right. And so even if you take somebody off opioids, if they still have chronic pain, you didn't fix the issue, right? And so the way that we think about it at Zion is we think, well, we do have data. There is data out there around CBG and that it has anti-inflammation properties. And so a lot of pain is a direct result of inflammation. And even when you think about things like, IBS or things that in the stomach, you're getting inflamed bowels, right? Or even if you have neurocognition issues where you're overstimulating something, or you get interocular pressure and vasodilation where you get pain in your head. I mean, when you think about all those type of things, well, okay, how do we reduce interocular pressure? How do we reduce histamine production? How do we reduce inflammation? And when we start thinking about that is, okay, now that we kind of know what the issue is, what cannabinoids do we know of? And is there any data whatsoever that suggests that it can do this, 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 or this? And so from our perspective, we look at CBG quite a lot to help with pain. And so most cannabis plants, and I would say almost all cannabis plants, even though they start, and we've talked about this in a previous episode, they start with making CBG. CBG immediately gets made into THC inside the plant. So you don't have a lot of other cannabinoids other than THC in medical marijuana. But there are strains of industrial hemp that are only CBG. And so in our facility, we also extract CBG specifically, and then I can turn that into an isolate or a powder form, and I can literally add what we think an effective dose is for lowering inflammation, which is good for long-term pain. We have had, and this is anecdotal, of course, but we have had hundreds, if not, thousands of individuals say to us, I had tendonitis so bad in my elbow, I couldn't play tennis anymore. And we were talking about surgery. I no longer have to do that. I feel great.
Pretty cool.
Yeah.
So THC makes the CBG work a little bit better.
So when we think about multiple cannabinoids in any kind of a formulation, we're talking about an entourage effect. We're talking about multiple cannabinoids dosing or doing an effect. Now, there's two kind of parts to that are important. One, when we think about cellular uptake of cannabinoids, THC has a higher cellular permeability. What that means is THC will go across a membrane easier than other molecules. And so if you pair a little bit of THC with something, typically speaking, you have higher uptake in the cells.
So THC mixed with CBG, really good for pain because you get that disassociation a little bit with the THC, and then CBG has been shown to work in that inflammation in the process. So pretty good combo.
And I usually throw a little CBD in there as well. And so that's the way that we think about pain. Arthritis. So when we think about arthritis, typically it's swelling in the joints. And that causes pain. And so what you want to do is reduce that, and then it helps with arthritis. But typically,
yeah. And when people are using cannabis for arthritis, like I have a lot of patients who with knee problems, and they find that when they use the cannabis, there's two things that happen. One, for some reason, they can do the things they want to do.
Yep.
Right? Why
right.
is that the CBG or is that the THC?
It's the CBG in conjunction with the other cannabinoids. The THC, again, when we think about THC, your body knows what to do with it. It stimulates the dopamine receptors. And so that will help with disassociation. So it can take the edge off. There's a whole bunch of benefits to the THC. But having said that, THC by itself, there's not a lot of evidence to show that it actually lowers inflammation significantly.
And I find with the patients, like I said, that ability to, and we use the term disassociation, and we use that term a lot in medical cannabis and medical marijuana discussions, because disassociation essentially means you're being able to separate yourself from your pain enough to get on with your day, to get on with the activities that you want to do. It's one of the things that I find works, that THC works so well for, is not to get high, but my knee hurts. If I can just disassociate from that knee pain enough, then I can do that walk that I want to do. I can walk that 1.5 miles.
So specific products, tinctures are good for that. If you're having instant onset, like neuropathic pain or something that's like shooting pain, obviously a vaporized product that's going to bypass metabolism is useful. But I'm a huge fan of topicals. I was a little bit rowdier in my younger days, and, my knuckles hurt. I'm not getting any younger. And I find that some days when I'm just stiff and I can't move very well, little balm, and literally within a minute or so, I can move my fingers again. Yeah. And here's the great thing about real medicine, and this is really awesome. You don't have to be a believer. Real medicine just works.
This is the thing. You've hit on a key point. And the non-believers that cannabis is just for getting high, right? Like, the fact is, if it works, it works.
One of my favorite stories ever is we had this little bit older woman who said, I've had arthritis for the last 30 years and I have tried everything with my doctor, everything. And there's no way, and her fingers were actually bent. She couldn't unlock her fingers. And she sort of was pointing at me like this. So there's nothing you can do to do this. I've lived with this my whole life. And so we rubbed some balm on her knuckles. And I said, this is going to be a great moment for you to prove me wrong. And then after a couple minutes, she's like, now see, I told you. And she's pointing and moving her fingers, and they were completely locked before, which again, you don't have to be a believer. It just works when it's real medicine.
Join us next week when we talk about nausea and how cannabis and different cannabinoid products and compounds can help with nausea.